So, oops. Good afternoon. I'm Ingrid Lundberg. I think I met most of you before lunch. I'm very happy to be here and talk about exercise in myositis. And I'm very excited to see so many people here at the last session of the conference and also for the exercise. So first of all, I would like to acknowledge my collaborators back home at the Karolinska Institute and who have been very instrumental in what I'm going to talk about. Is physical therapist, assistant professor Helene Alexandersson, who made her thesis work on development of exercise program for myositis. And Lee Alemo Munters is also a physical therapist. She is a current PhD student in this area. And of course, I would like to acknowledge all brave patients at home that have participated in our studies. So I'm going to talk about exercise in management of myositis. And what I'm going to talk about is why should we exercise, both in general perspectives and if you have myositis, and also how you could exercise when you have myositis. First of all, I would like to remind you of general health recommendations for physical activity. This is set up by the American College of Sports Medicine. And the recommendations are that you should, sort of everyone, be moderate to intensity physically active 5 days a week, 30 minutes. And that means 30 minutes in total. So it could be 10 minutes walk in the morning, 10 minutes during lunch, and 10 minutes in the evening. But 30 minutes per day. But in addition to that, they have now added this strength training twice a week. So, and this physical activity could be household work, like if you do cleaning or lawn mowing or snow shoveling. It could be biking, or this could also be replaced by more intensive aerobic exercise 3 times per week for 20 minutes. And why should you do this? Well, there are now, as I'm sure you are familiar of, many studies that have demonstrated that physical activity is good for your heart. It protects against ischemic heart disease. It protects against diabetes. It lowers your blood pressure. And I've taken one example here. There are many population-based studies, and some of them have been summarized in this slide. And what this slide tells us is that if you are meeting the guidelines for physical activity, that means here with a physical activity between 3 to 5 times per week at least, then your risk for cardiovascular incidence is this compared to if you have a low degree of physical activity. So it means by increasing your physical activity from 0 or 1 up to 5 times, you improve or decrease your risk for cardiovascular incidence. So, and then when you have myositis, you have other problems that would benefit from exercise. The typical symptoms, as you all know, is muscle weakness and low endurance, and also low fitness, aerobic capacity. And as has been shown from some studies using questionnaires on quality of life, patients who have myositis have lower quality of life, health-related quality of life, and a sustained disability. And this goes for most patients that have myositis. And this is in a higher magnification, and this is health-related quality of life as measured with a questionnaire that some of you may have been filling in. Is called SF36, where you have these 8 domains. And the black bars indicate what people in the normal population have rated, and up here is sort of the maximum good life. And this domain is called physical functioning. in this population, this is in the UK, people have indicated about 90%, whereas patients with myositis have a much lower physical functioning. Whereas you can also see role functioning. So these are based on the physical activity. So we have here challenges and how we can improve this. So how could we exercise in myositis? When, as I mentioned this morning, when I started in rheumatology in the 1990s, in the textbooks it said that if you have inflammation in your muscle, you should rest. And then there was this man coming into my office who he was, must say, disobedient, because he trained against our recommendations. And he had been physically active before and started to train again after he started with his medication for myositis. And he lay down on the floor and did this number of push-ups and could really demonstrate that he had improved. So then I went back to the literature to find out what was the reason for recommendations of not doing exercise. And then, interestingly enough, what I found was observations from muscle tissue in healthy individuals the day after a marathon race. So people had taken muscle biopsies within 24 hours after marathon race. And when you look at a biopsy from a muscle, you can imagine with the pain, and there are lots of inflammatory cells, because this very hard exercise may induce inflammation. So that observation had led to the assumption that if you already have an inflammation in the muscle, that it would be harmful to exercise. But there was actually no data to support that it was harmful. So then we started our first studies on exercise. And the first case report showing that exercise was safe came from the US in 1993. It was at the same time that we designed our first study of exercise in myositis, with the primary aim to investigate if exercise was safe. By now, in 2011, there have been 15 studies on exercise in myositis, and although very few patients, must say, in all studies, but despite this, all studies have come out with the same result, that exercise is safe. And there are also data to demonstrate that you can improve your function with exercise. And this is being shown now for polydermatomyositis in adults. In juvenile dermatomyositis, there is actually no exercise studies that have been published, and you heard Dr. Brian Feldman this morning telling you that he is now involved in projects of exercise in juvenile dermatomyositis. There is only one study that has demonstrated that one acute sort of exercise test on a bike or with the arms was safe, but that was not a training program. Concerning inclusion body myositis, the results of the exercise tests have been more inconclusive, but I would tell you some results that seem to be optimistic. So what we can say now today in 2011, there are data to support that exercise is safe and could be beneficial. So then, what type of exercise have been used for myositis? Well, there are publications on resistance exercise, on aerobic training, on endurance training. And aerobic training could be step up or on a bike, and endurance training is more long distance running or jogging or walking. So I will present some results from these types of exercise. One of the first studies that came out showing that exercise was safe was this study from Austria, where they used aerobic exercise with 30 minutes on a bike, followed by 30 minutes step up. So there was 1 hour exercise on 65% of the maximum oxygen uptake. So that is something you can measure with your heart rate. And this was done 3 days a week for 7 weeks. And this was a controlled study, meaning there was one group that did exercise and one group that did what they had done before, sort of non-exercising. And they could here show a significant improvement in the exercise group on the fitness. So this was safe and it could improve fitness. We have done one study with a more tough resistance training to improve strength. This was a study that we designed to be performed 3 days a week for 7 weeks. And here the participants had to come into the hospital and to use these machines. And we trained with different number of sets. So there were 5 muscle groups that we trained. Here the shoulder muscles, the thigh muscles. This has, I think, stopped working. But you can see the biceps, the lower leg muscle, and the abdominal muscle. So these 5 groups. And the training program started with some warming up and then at the end stretch. So after this, which was quite tough exercise, we could measure an improvement in strength. And this is demonstrated here. On the left graph, you see a measure called voluntary repetition maximum. And this is from the thigh muscle and before and after training. So the lines are from the individuals. And you can see that everyone but one improved. And also with this manual muscle test 8, there was an improvement, and the manual muscle test 8 measures 8 muscles. So there was an improvement in the 8 muscles that we measured. So this was strength. And what we also did in this study and what we have done in the other studies, we have investigated if we could see any explanation for the improvement, or also if there was an increased inflammation, by taking muscle biopsies. So here you can see where we took a muscle biopsy at baseline. That was before the training program and after the 7 weeks. And then we investigated molecules in the muscle biopsy. And we first looked for inflammation, and there were no signs of increased inflammation. But in this study, we used a novel technique called gene expression. This is a technique that allows you, by putting the muscle tissue that has been homogenized, you put it on a little chip, and then you can see changes of many molecules. So you compare the expression of molecules in the biopsy after compared to the before. And there are all these 20,000 genes you can investigate. And here we looked at the difference. And there were about 200 genes that differed in the second. Oh, thank you. In the second biopsy compared to the first. And the largest group of genes that changed were genes involved in inflammation. And what we thought was remarkable, that most of the genes had a lower expression after the exercise. So they were downregulated, and very few were upregulated. That was just the opposite what had been supposed to happen when you exercise. The other group of genes that were changed were genes that involved fibrosis, genes that when they're activated, they induce connective tissue, so the muscle will be replaced by connective tissue. Then you can, of course, not contract the muscle. And what we found here was that these genes were downregulated. So then we looked for, now genes, when they are changing, that doesn't mean that there will be a change of the product, the protein. So in this case, we also measure the product of the fibrosis. And that's with different techniques. But you can actually see here, this was a person before the training, and the dark green here are muscle fibers in cross-sectional, and the white space between is connective tissue. And this is what we see when there is an inflammation. Often the muscle tissue is replaced by fibrosis. But after the exercise, the space for fibrosis had decreased, and we could measure it with different techniques. So we can actually see that there was less fibrosis after 7 weeks of exercise. And this was in the thigh muscle that was also trained. So what we could conclude from this small study was that this type of exercise, which was quite tough resistance exercise, was safe. The patients improved in strength. And I say, this study indicates that training of this type may even reduce inflammation and reduce fibrosis. Although this, I think, would need to be confirmed in a larger study. The type of exercise program that we have used the most is a home exercise program. This was also the first type of exercise that we set up in around 1993. And this is a quite modest exercise program where we make a number of repetitions in different muscle groups, and we try to avoid overuse, so we change between arms and legs and so on. And this program, I will demonstrate it here later, this was combined with a 15-minute walk for 5 days a week for 12 weeks. And I will here demonstrate what it looks like first, and then you will see it live. But it starts with a warm-up. You can see on a quite low stool that you step up on. After that, you have exercise for the motion of your shoulders, and you move your arms. And you have a test of your grip strength here. It includes strength training of your thigh muscle and of your shoulder muscle. And these are muscles that are often affected in polydermatomyositis, and the thigh muscle also in IBM. It includes also strength training of the pelvic muscles here, and we also have of the trunk muscle, sit-ups, and training of the thigh muscle here again, and the pelvic. And these are muscle groups that are involved in most patients with myositis. And this program ends with stretch. You can see both of the arms, legs, the thigh, the lower leg, and the neck muscles. Now this quite modest program, where we also have it with different levels, resulted in improvement that we could measure. This was a functional test. It's called Functional Index of Myositis. And it's a test that measures the number of repetitions that you can do in several muscle groups, both arms, legs, and the neck muscles. And the maximum score is 64. And for this study, before the training, we started off with a mean value of 48. And after the 12 weeks, there was an improvement in this endurance test. But still, there were most patients did not reach the maximum test. So this was one of the tests showing that this was effective. And as one safety test, we had serum levels of the CPK, which did not increase. We also took muscle biopsies here. We didn't show any sign of inflammation, and we did MRI scans of the thighs. So this program, we can say, does not increase the inflammation in the muscle. It also resulted in improved health-related quality of life. This is the same questionnaire that we had before, that I showed before. This from results from a UK myositis population. This is from our study, where we can see that the physical functioning was low, as in the UK, but after this 12-week program, there was a significant improvement in this area. So the interpretation is that this type of program, you can improve your function and improve that part of quality of life. So what about exercise in sporadic inclusion body myositis? We have done a similar project on inclusion body myositis with this home exercise program, where we actually could not see an improvement. There was no deterioration, but no significant improvement. But last year, a couple of years ago, there was one study from Australia that I think is optimistic, and they had used a similar type of functional training as we had in our exercise program, plus some strength training of the thigh muscles. And moreover, they did this program twice a day, 7 days per week, and for 16 weeks. And here, in this small group of individuals, they could measure an improvement in walking time. I think it was 6 minutes walking time, and also in the getting up through a stair. So this means shorter time to walk a certain distance. So you could actually improve also in inclusion body myositis. And in another study from the same group in Australia, they have also been able to measure improvement of fitness after resistance exercise and cycling 3 times per week. These are small studies, but they indicate that there could be a positive effect also in inclusion body myositis. So now I was going to demonstrate how we do this exercise program. And I invite you all to participate in this exercise program. This is going to be, as I was told, an interactive session. So I invite you to do what you can do from in this room with these possibilities that we have here. I will go down to the floor. It takes about 15 minutes, so either you rest or you do some of this exercise. For this program, it can be done at home. You don't need any special equipment. We have 2 levels of the program, what we call easy or moderate. So if you are very weak, you start with the easy. If you are a little more strong, you can probably start directly with the moderate. And I will show now the moderate. In the moderate, you use a couple of weight cuffs. I have some substitute for weight cuffs that could fit into my cabin luggage, so they're not so heavy, but otherwise you can adjust your training effects by the weight of the weight cuffs. And we also have this, I don't know if you have that in the US, I think so. It's called SUSI apparatus, and I will show you how it works. But this is particularly important if you are very weak in your arms, because you will pull instead of lift your arms, and I will show that. And so, yes. And then you need a bed or a chair and a little, some steps to start on. So I would like to have could we have the music? So for this warm-up, as I have a step, you don't have a step, but what we do, like, we take 10 steps, I step up, right leg, left leg, and down, right leg, left. Can we have a little lower? Can you lower So you, now as you're standing on the step, you just walk like this, and I will do it. Right leg, left leg, right leg, left leg. Right leg, left leg, right leg, left leg. I will start. Right leg, left leg, right leg, left leg. You do this 10 times, and you feel that you get a little, your pulse increases, and you get a little warm. Then you do the same with starting with your left leg. Left leg, right leg, and down. Left leg, right leg. 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 Okay? So that, now we're a little warm. And then we will start with the exercise for mobility in your shoulders. I may introduce my assistant, my daughter Åsa. So for this, now we're going to work with the shoulder muscles and the mobility. And here, as when I have this apparatus, I pull down and the arm goes up. But you can lift a little forward, so you have it front, good. And up, 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 up. And all these exercises you do with 10 repetitions. So you can calculate that. You can start with 2 or 3 and then increase when you get stronger. And then you do the same but with your elbows up. So out, left, good. And as you can see now, if you are very weak and cannot lift your arms by yourself, this machine will lift your arm. And that's very important so you don't get contractures in your shoulders. Very good. I think some of us will have some sore muscles tomorrow. So now you can rest a little bit, so let your arms hang. And now we're going to work with our hands. This is grip strength. So you can use rubber balls or something, and this is included in this device. So you squeeze with your right hand, squeeze with your left hand, squeeze with your right hand, squeeze with your left hand. And we have seen in our research study that most patients with myositis are actually weak in their hands and have a lower grip strength compared to healthy individuals. And that goes for all myositis in adults. In the textbook it says it's only inclusion body myositis, but we have seen now that this is not true. So I think we all could benefit from some strength training with our hands. Thank you. And now we'll do the strength training of the shoulders. So I put on my little weight cuffs here, and I recommend that you start without weight cuffs the first times you do this. And now you're going to train your shoulder muscles, so you lift up your arms like this. 1, right, left. Close to your body and as far up as you can above your head. Left, right. Does it feel okay? Great. And if you have some pain or so, you stop. So don't force if you have pain. I've lost count. I think we are almost there. Okay. So now we're going to do strength training with our thigh muscles. So now we can sit down. So here, again, we are going to tension our thigh muscles and straight out the legs. And here you can also put on some weight cuffs on your ankles to make it more difficult. So now you straighten your knee and you lift up your leg, and the toes should point towards the ceiling. And hold it for 5 seconds, and then rest. Take your left leg and shift to the right leg. And lift your leg as high as you can. For some, this is impossible if you do it sitting, if you are very weak, and then you may lie down and straighten your legs. Left. And then when you put weight cuffs on, this is more heavy and you will improve your muscles further. So now, the next, you can sit or stand. So now we'll do some training for the shoulders. And this is also both for mobility and strength. And then you put your right arm in your neck as far back as you can. And then out with your elbow. Try to rotate out your elbow to the right. And then you can feel your muscles are working. Change to the left, same way. Take your left hand in the neck and out with your elbow. Right. And left. Do it a few more times. Right arm. Right and left. Okay, the next exercise is also with the shoulder muscle. Now you put your right hand on your left shoulder and up with your elbow now. That's good. So you feel you're working now with the outer part of the shoulder muscles. And change. Left hand on your right shoulder and up with the elbow. Right hand on your left shoulder and elbow up. And left hand. And once more, right hand on the left shoulder and elbow up, and left hand. And then we go to the next, and that is also shoulder mobility. Now you take your right hand and put it on your back as far down and away as you can. You now feel you're working with the front side of your shoulder muscle. Maybe easier if you stand up. Take the left hand, put it as far back as you can on your back. Right hand on your back. And left hand on your back. And right hand on your back. And left hand on your back. Okay. So when you do this at home, you increase the number up to 10. And now we come to the pelvic muscles. And here we need to have a bed or you lie down on the floor. So I would demonstrate this by lying on this table. There will be 4 exercises. So now the first exercise, so these are mostly for your pelvic muscles. So then you lie down with your knees bent and lift up like this and hold it for 5 seconds. And rest. And lift as high up as you can. rest. And once more. Okay, and that you should do 10 times. And now we will do the sit-ups. And for sit-ups, you bend up your head and try to lift your shoulders and hold. I see a few people doing this. That's great. And rest. And again, lift up. And rest. And here, of course, you can use your arms in different ways. But if you just lift up, here you use your abdominal muscle. So lift up. Hold on. And rest. And one more time. Lift up. And rest. And now, you will stretch your legs and we will put on the weight cuffs. For this exercise, you lie down on your back and lift one leg at a time with a straight knee. So you lift up about 1 foot from the floor or from the bed and hold it for 5 seconds. And then you lift your left leg just a little above the floor. And this is also a good exercise for your thigh muscle. And rest. And right leg. And rest. Here you can also put on more weight cuffs when you get stronger or more weights. Left leg. And rest. And right leg. And rest. And the final left leg. And now to the last exercise. Then you lie on your side. I will start with my left side. I bend the lower leg so I have a good position. And then I lift my right leg just like a foot. Hold it there for 5 seconds. And rest. And lift. And this you can do some of your lifting while you are sitting. And rest. And lift and hold it for 5 seconds. Okay, and then I lie on the right side. Again, bend your lower legs so you're stable, and then lift your upper leg, the left leg, just a little. Hold it for 5 seconds. And rest. And lift again. And you who are sitting can lift your legs straight forward. And rest. And once again, lift. Okay. So now we have done the exercises, and there will be some stretch exercises. So the first is to stretch out the whole side, and you can do it lying, or if you want to stand up. I will ask my yes. So you take your right hand on your left wrist and stretch out. And when you're standing up, stretch on the now left side as much as you can and hold it there. And it's important now to stretch for about 20 seconds. And relax. And then do it on the other side. Of course, you can also stand up and stretch. You can feel the whole side from your foot up in your hand. Okay. And then we have worked with our thigh muscles, and here we can do it. Now we're going to stretch the front side of the thigh. You can do it different ways, but if you have difficulty in standing, you can sit like this on your bed, and then strain the left thigh. So if you sit on a chair, you can probably also stretch out the thigh muscles. You feel that you can stand, if you can, like this, or you can sit also like this. So you feel that you have the stretch here in front. And then we change to the other leg. Nu har jag gjort det förut. This. Okay, and then we have worked with our lower legs a bit also. So now we stretch the calf, the back side of the lower leg. And for this you need to stand up. And you put your right leg a little behind you with the heel in the floor. And then the left leg a bit forward. And now you lean on the left leg. And then when you bend down, you will try to find that you can feel the stretch on the back side of the lower leg. You have sort of to, but you have to, the heel has to be in the floor. That's the key. And then we change legs. Put your left foot behind with heel in the floor and the right leg in front of you, and put your weight on the front leg, and put the foot in front so you have don't put too much load on your knee. And here again, stretch your back of the left leg. Okay, and the last stretch is for your neck muscles. So now when you stand, relax, and with your arms hanging, just bend your head with your right ear towards the shoulder, and let it stretch on the left side. Raise your head up slowly and bend it to the left side. And feel the stretch on the right side. Okay. That was all for the exercise. Please take your seat, and I will finish up there. So, okay. So what did you think about this? Wasn't it nice? Yeah. So I just wanted to end up with a summary that what we have learned over the last 20 years is that exercise, if you have an inflammatory disease of the muscle, is safe. It is effective, and you need to have the right type of program. Start low, start slow. And this is a complement to pharmacological therapy. It may, as I said, we have some indications that exercise may even be beneficial for the inflammation, and it may inhibit some of the fibrosis in the muscle. And now I've shown you one type of training, this very moderate home exercise program. I have told you that also fitness program with aerobics works, and also the resistant, tougher strength training works. And I think we don't know yet which type of training is the optimal. It seems that this home exercise program is beneficial when you start, when you have been inactive or when you are very weak, but then there are possibilities to increase that by having more weight loads on. And probably we should do this combination with some strength training programs per week and some more endurance training. But I think we have learned over these 20 years that exercise is medicine, so it's an important part of the management. And finally, I would like to acknowledge the people that are working in our group, and in particular the physical therapist, as I mentioned. And you can see Helene there and Lee there. So these are the physical therapists that have learned, that have been working with the patients, and I have learned a lot from them on the effects and the importance of being physically active. So now I'm ready to take questions, and thank you all for participating in the program.
What can you do for abdominals if you can't lift your head? I can't lift my head up like that.
When you start, then what you can train is lying down on your side. And then if you have, with the physical therapist or someone else, you can get resistance with someone holding against your head. But the weakness of neck muscles is very common and often overseen, I think. But that was not included in this program. But that's but you have to start lying on your side to overcome the gravity.
I have a question. I'm right here. Those of us that have IBM have special needs to get exercise. So many of us have lost the muscles in the thigh, and yet the hamstrings underneath are strong. So our knees are just totally gone, unstable. And so we can't stand to do exercise. We also have flexor problems, so we don't have a grip to hold on to weights or to be able to hold on to anything. Do you have any suggestions for us that way? Also, when you're in a chair, how can you get aerobic exercise? I miss it so much because I did exercise regularly and hiked and was very active. And I feel that, like your study showed, our mental attitude would be far better if we felt that there was something that we could do to exercise aerobically and just to keep limber.
That's of course a very challenging question. What we are testing now, or our physical therapists are testing, what is called vibration plate. So, and then you have to hold on to something, or you can have something around you to keep you stable. So we are testing whether that works in individuals who are very weak, like you say, some who have IBMs. For aerobic capacity, some have done hydrotherapy, if you can have some assistance in the water. But it is a challenge, I agree. But the physical therapists, I think, are now developing tools or programs also for when you have lost your muscles. And that's what we have seen. It's very difficult to recover muscles once you have lost them. But that's one possibility to try.
Hi, Ingrid. I found your research about 12 weeks into my muscle involvement with my DM and started some pretty aggressive physical therapy. I was kind of the one that was going to do the push-ups on the floor and prove it. So I've been able to increase my frank strength well. There are still some things I can't hold an empty muffin tin. I can't hold a plate out in front of me. My endurance is still so low. Even though I can walk on the treadmill, I can't walk at the grocery store or in the hotel. How long would it take, would you expect, before endurance might follow the strength?
Well, what we have seen is when we did this resistant exercise, which was strength training more, then the patients did not improve their endurance. So that's why I think we need to combine or have a more focus on the endurance training, like more of this, the type of exercise with the home exercise program, but longer. This was only 15 minutes, probably too short, and that we can improve that. So we are working on that now, and we have a 1-hour program with endurance focus. I don't have any data, but I would suggest that you focus more on endurance training. And what we heard this morning from Dr. Radio, and we are collaborating, there seem to be different mechanisms that cause muscle weakness, probably different in IBM and dermatomyositis, and we need to handle them differently, also with the exercise.
Thank you.
Hi, I have severe cramping. I've been exercising, doing the gardening, and I'm really pleased with my ability now. But I still have the horrible thigh cramping, feet cramping, hand cramping if you garden and try to shower that night. You know, you just can't even wash your hair. Is there anything? I've done the quinine. I'm finding pineapple juice helps, but is there anything else?
Sometimes it could be prednisone. Sometimes it makes you have more of the cramps with the cortisol. It could be that there is some imbalance in the salts, the sodium, potassium. So maybe you could ask your doctors about that, or even calcium. So there is not some other metabolic changes that may occur with the medication. Or if you have diuretics or steroids, that may affect that. Otherwise, I don't have a good suggestion besides what you have already tested, unfortunately.
The exercises that you demonstrated, would they still be beneficial if a second person was assisting the myositis patient with some of them?
I think you have some of them, as I showed the movements, you have, that is to keep your mobility. And that is, of course, very important. And that could be assisted by someone else. To become stronger, you have to do some activity with your muscles. But if somebody holds and you can do it a little, it will take longer time. But I think it's more important that you do the exercises, even if someone assists you, than if you don't do it.
Hello, my husband Ray has polymyositis. He's been actively in pain for about the last 6 months, and he's been unwilling to get on an active regimen for exercise because of the pain. Is it safe to exercise when he's in pain?
I would say depending on the cause of pain. We have pain, we see pain in patients after the exercise, which is quite common, I think, when you start exercise. My experience is that we have seen more of that post-exercise pain in patients with dermatomyositis, and that means very little exercise, like going to the store to do some grocery shopping, and you have lots of pain down the day after. Our experience from this training program is that this pain resolves if you keep on, but you start low. So then next day you may take a shorter walk and increase the activity slowly. And when the patients have gotten into a regular program, then the pain goes away, and if they stop exercising, they get it back. So that's sort of some kind of exercise-induced pain. Then, of course, you can have pain from your joints or tendons that's more related to the movements. And I'm not sure if that will go away. I think it depends on how much you do. What we can say from our experience and from others is also in rheumatoid arthritis that even though you have pain, it doesn't seem harmful.
Does that pulley device have a specific name so we could search for it online?
This Sussy, yeah, I can give it to you. Yeah, it's Sussy, Sussey, I think. I can also send you information if you send me an email. I think you have the, and then I can find out where we have bought it.
Given what appears to be somewhat equivocal results with the IBM group with exercise, what kind of guidelines or recommendations would you offer for someone who wants to pursue a program in terms of what kinds of feedback should you be looking for to tweak it up or tweak it down? You kind of referred to it in this earlier question, but do you have any other suggestions on how you can guide yourself to do it?
So for the IBM exercise, what we have learned now from the publications is that it seems to be requiring, or the IBM patients seem to require more exercise. That was twice daily, every day. And that's what we are setting up a project on to see if we can confirm that. So that's what our physical therapists now recommend those who have IBM. Was that an answer to your question?
I have a question. I have IBM, and when I'm eating breakfast, and after I get through, I stand up, and then I bend over to pick up my cereal dish or whatever. I have a hard time straightening my back, straightening up again. It takes me, it hurts. Is that, what's going on? Why do I have such a hard time straightening up?
That would indicate that your muscle in your back or in your abdomen are also affected or are weak from the disease, or from if you have had a low activity because of your disease. And then in this program you work with your belly muscle, but we don't have any, there was no exercise for your back. But I would ask my doctor also both to look at the spine, so there is not a problem with the spine that causes the pain, or the problems that you have. So maybe you have to do some X-ray or so because you can have problems, of course, from some other reason from your spine, which also could cause these problems. So I think it's important to know that before you do exercise with your back, because that could be. I
see. Thank you.
Hi, thank you very much for your great presentation. My question is, have you ever encountered exercise with patients diagnosed with necrotizing myopathy, and if you've seen any improvement in their muscle strength?
We have a few that I just at the moment can recall, and I have one man who has a necrotizing myopathy, and he has been exercising quite regularly, but he has more of the pain problem that maybe someone here referred to. He has a lot of pain, but often that pain resolves when he does exercise on a regular basis. And he has unfortunately lost hamstrings muscle, but he can train with his remaining muscle like quadriceps. Unfortunately, the training has not prevented loss of some muscle groups. But for the symptoms, it seems to be beneficial to train, although because he gets less pain then, and he feels better, and he can move around better. So we haven't seen any negative effect, but that's only case reports.
Thank you.
I have IBM, and I've been using light weights to try to build upper body strength. Should I be using those, or would the pulley be better for me?
Sorry, I missed the beginning of your question.
Yes, IBM, and I've been using light weights.
Yeah.
No heavier than 5 pounds, usually 3 or 2. And I just wondered if it would be better to use the pulley apparatus, or can I get the same results from the weights?
I think you can get better results concerning strength and with the weights. The pulley apparatus is more for the movement, and if you can do that movement without the apparatus and even with weight cuffs, that's even better, because that will improve your muscles. So the pulley apparatus is more for the movement if you cannot lift by yourself.
All right, thank you.
Who had a question?
Here. One here and one there.
We'll go here.
I exercise fairly regularly, but I don't use weights. If I were going to use weights, what weight would I use to begin with, and how often? I mean, as I get stronger, how should I increment that?
Our lowest weights, I think, are 500 grams, like a pound, 1 pound. Yeah, so that, and then we can increase it to 2 pounds. So it's very low. You start low.
I was thinking of starting with 3, but you're saying
no, I think you should start lower and see how you can tolerate that, and go slow. Otherwise, you will be disencouraged to continue. So do it slow and have a lot of patience, and then you will see that you can improve it slowly.
Okay. Thank you.
Thank you, doctor. And I have a question. My husband has IBM, and he exercises, but when you have IBM, you have to be very careful, I would think, and not over-exercise because you don't want to strain the muscles. So would it be beneficiary for him to do regimens every day or every other day so that he does not make them, strain the muscles?
Yeah, that's, of course, we don't have the complete answer of that, because we have done this every other day, and then we didn't see any beneficial effect. We could not measure any improvement of the performance. But the experience from a smaller group in Australia, where they did every day, twice a day, there they could measure an improvement. But I think it's a balance there. You cannot start with that. Probably you should start maybe every day with a short program and then increase it step by step. So obviously there was no reported negative effect of doing this twice a day, every day. But I think you should start with short programs and without weights, and then put on that slowly. And I think when you go to gym, you don't start with the toughest machines and so on. But when you now, if you have a muscle inflammation, you have lost a lot. You have lost some muscle fibers. You have lost a lot of capacity. So when you do like standing up, walking, and a walk and a stair, you may work on 90% of your muscle strength. So you are actually working on the limit of what your muscles can tolerate. So that is how you should think. So then you should not strain, like they had done this aerobic capacity, did that on 65%. of their maximum heart rate, you should start lower, and that means you should start much lower than when healthy people start, because otherwise you may risk overuse of your muscle. The question was with head drop, that would indicate well, that's a weakness of the extensor, the back side of the muscles. So then that would mean that you should focus your training on the back side of the muscle. Now we have talked lifting up your head, you work with the front side. So then you should do some work on, I'm not a physical therapist, I didn't develop this. I would ask the physical therapist, but probably you should start also, if you are very weak, lying down on your side and moving your head backwards against resistance. Okay, there are no more questions. Then I thank you all for coming. Oh, was there one more? One final.
With the apparatus that you were using, just personally, I would go down to my local hardware store. I would get a pulley, about 6 feet of nylon rope, and about a foot of half-inch PVC pipe, and I would make it myself for probably $2 or $3. Just a suggestion.
Very good. And then you can have some rubber balls and squeeze that you have just separately. All those, that's very good. Thank you for the suggestion. And there is one more question here.
Is it possible to overexercise and do permanent damage to the muscle?
That's a very important question, whether there is a risk of over-exercising and that would damage, to make more harm. And we don't know that. Actually, we have that concern all the time. That's why we recommend to build up slow, start slow. And we started with this moderate exercise program. I still think that you should be advised. You should have individual advice by a physical therapist or a doctor on how much you can do, and then how much you can increase, like the resistance. And if you get a lot of pain the day after, you have probably done a little too much. So then I would do less the next time. So the pain after, if that also goes along for several days, that's an indication that has been too much, as far as we understand. We are a bit cautious. But so far we haven't seen any damage.
The pain that you mentioned, would that be pain from are you referring to like lactic acid, or from
yeah, that's what we think it is, but or what that's the. It has not really been shown what it is that causes this delayed onset muscle pain that you get after exercise, but it's obvious that those that have myositis seem to get this much more easy with little exercise, and it stays on for several days. And I think then you have done too much, then you should go back, take it a little lower resistance, little shorter time of exercise. That's what we think today. We need to study this more. Okay. Thank you all for coming, and enjoy the evening.